love a prophet, we love a prophet, we love a prophet, we love a prophet. Abu Najma with kids. Abu Najma with kids. We learn Quran, we learn Quran, we learn Quran, we learn Quran, we learn Hadith.
Assalamu alaikum warahmatullahi wabarakatuh. We are now at the Arena 1. And over here we have player of the day.
I'm back to beat Hamza's team.
Is it timer?
I chose Surah Al-Mutaffifin. I don't know the names, but Nabi Isa said, I am a slave of Allah. Is it Prophet Luqman?
1 point for this team.
Welcome to Active Sunday.
Things which will happen at the last day, which is very shocking.
Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show. Na mtazamaji, shukran sana kwa kuendelea kutegea the premier Islamic TV station Horizon TV. Welcome onto the second segment of the Sabah Show. You are watching Healthy Thursday with Mariam Mwacharo. Today we'll be delving matters cancer. Now we'll be taking a look at a general aspect on cancer, and in the weeks to come, inshallah bidnillahil kareem, we should be looking at specific cancers that affect people, especially in our country. Statistics as they stand now is that 1 in 5 men and 1 in 6 women develop cancer in their lifetime. And in those statistics, 1 in 8 men and 1 in 11 women actually die from cancer in their lifetime in the world globally. And that is according to statistics of WHO, and that was gazetted put down formally on the 12th September 2018 according to WHO, and that was just last year. Right now more research is being done on cancer. With me to discuss this topic is Dr. Edward Sang. Karibu sana katika kipindi chetu. Mainly based on at MP Shah. He's a gynecologic oncologist, if I'm not wrong.
Yes.
Karibu sana.
Asante.
Dr. Sang. Now, if we can just start right away, Daktari, if I may ask you, most of the research says that cancer cells are usually normal body cells in our body.
Yeah.
They're just normal cells that tend to misbehave. Many people may not understand what this misbehavior is. Kindly give us a proper definition and understanding to, a layman as to what cancer really is.
Well, cancer is, as you say, the cells behaving abnormally. Each cell has a program. It's almost like a computer that it's supposed to have a time when it's born, it lives its life, and it has to die. So at a specific time, the cell has to die. For example, if you have on your skin, every few days the skin peels off
yes.
and a new skin comes. So imagine like the skin not peeling off, it refuses to peel off, then there would be an extra layer of skin which is not necessary. The same thing with cells. The cell, after it's done, it has had its lifespan, should die. But some things can make that cell refuse to die. For example, a virus. A virus can enter the DNA of the cell and control. The DNA is what controls the cell. So it goes in and controls the cell and makes it multiply and grow and divide and even spread to other parts of the body. Just like a virus in a computer, this virus goes into the cell and makes the cell behave the way it's not supposed to. So for example, in the cervix, the human papilloma virus gets into the cell, goes into the DNA and makes this DNA make the cell divide more and more instead of dying. So that cell now, you get so many of those abnormal cells, and then you get the growth, the cervical cancer. Yeah.
And Dr. if I may ask you, throughout your years into being a gynecologic oncologist, apart from cervical cancer, what are other common cancers that affect our people here in Kenya?
We see a lot of ovarian cancer, cancer of the uterus, cancer of the vulva. Yeah, those are the main ones. And so they cause a devastating effect on women, partly because we get them when it's quite late.
Yeah.
So by the time a lady comes to be seen, it's probably spread, it's not operable, it's hard to treat. So that's the problem we have.
Yeah. And say I am a young lady of productive age, especially when we talk about cervical cancer. What are the telltale signs that I'm actually developing a cancer? Say, for example, if I've never gone to a hospital at all. Yeah.
In fact, by the time you have those telltale signs, it's quite late.
Oh.
Because they only start when it's late. So when it's starting early, you don't feel anything. You're quite okay, everything is going well. Then when it's late, a lady starts getting irregular bleeding, for example, bleeding with intercourse, a foul-smelling discharge. So that's when the lady now comes for checkup. But by the time those signs are there, there's a huge growth in the cervix, and we are already late.
Yeah, and yesterday when I was speaking to some of my friends, they said, there's a way in which they would like to understand between a growth that is just a growth and a growth that is actually cancerous. How can you tell the difference? Because maybe I may have, a mound on my hand, and there I am suspecting that, oh my God, I probably have cancer, and I start getting scared and everything. But when I go to the hospital, it's just a normal growth that can actually be taken care of. So how do you differentiate between the two?
At times it's hard. At times it's a bit hard. So at times we do what is called a biopsy. For example, if there's a lump in the breast, you might feel there's a growth, it's abnormal, but we can't tell. So you would go into the hospital and they would take a small piece of it and take it to the laboratory, and they can tell whether it has cancer cells or not. The same with the cervix, the same with the uterus, the same with even the lymph glands. You can have a swelling on the neck, but we can't tell if it could be TB, it could be cancer, but so they have to remove it, take it to the lab, and then we'll be able to tell.
So say, for example, one has visited, a hospital. I have had signs, as you said, cancer does not tell that I am cancer, here I am, until it is too late. So say, for example, it was late. I did not know, and I'm there, I've got signs. What kind of tests am I looking to do when I get there?
Oh, it depends on where it is. So for ladies, when they come to the hospital, they might be complaining, they may not even suspect that there could be cancer. A lady may come and say, oh, I've got some irregular bleeding. So we would ask a little more, and if we suspect it's cancer, then we would do certain tests. Another issue might be a lady who has passed menopause. So she's 60 years old, her period stopped 10 years ago, then suddenly she's bleeding again. That one would suspect cancer. And even the lady, most of the time, would be quite anxious and rush to the hospital because she's wondering, why am I bleeding all these years later after the menopause.
Yeah, kumbuka mtazamaji, you can join in our discussion on our social media platforms on Facebook, Instagram and Twitter at Horizontv Kenya, ama unaweza kunitumia maswali direct kwenye Facebook yangu at Mariam Kasim, nami nitaweza kuaddress maswali hayo pamoja na daktari. Optionally, you can also give us a call directly on our studio on the numbers on your screen, or also send us a text message on the same numbers on your screen. Yuko hapa Hadija Galore. Actually, I think that question has, or the response that you've given has answered our question. Hadija anasema, I am 48 years old. I have not had my menses for like 3 years now, so I presume that I have hit menopause, but I just began my menses and I'm having severe menstrual cramps. Should I be concerned? And I have never gone to any tests whatsoever, especially of cervical cancer. I am afraid. Okay, she's afraid.
Yeah. Yes, so at 48, her period stopped like 3 years ago, maybe when she was 45. So I would say that she had gone into menopause, because once your period stops for 6 months, and you're around 50 years old, then we assume it's menopause.
Okay, so 40-something is not menopause?
It depends. Some people also go into early menopause, even at 40, even at 35.
35?
So, yeah, it can occur early in some people, but most of the time it's around 50 years of age. Yeah, so with this lady, what I would tell her is she needs to be checked quickly. Yeah, because it seems she went into menopause and now she's bleeding. So we need to do an ultrasound, check the uterus, are there any growth, and then we need to do a pap smear.
Okay, so Hadija Galore there, daktari amesema kwamba tafadhali nenda hospitali angalau uweze kufanywa ile pap smear wapate kujua kama pengine ni cancer ama si cancer, so you could possibly have hit early menopause, lakini menopause daktari amesema mara nyingi ni katika umri wa miaka 50. Producer wangu pale nyuma anacheka manake haya sitasema mengi lakini tuendelee. Mimi bado ni mdogo. So daktari, once we have established that yes, we have cancer, we've gone through the tests for cancer, what treatment options does someone have? Depending on, say for example, if I have cervical cancer, what treatment options am I looking at? Yeah,
so once we have confirmed by doing a biopsy, we first have to stage it.
Okay.
Are we dealing with an early cancer or a late one? So if it's early, we can operate. For example, it might be a very small growth, 1 centimeter. That one we can do surgery and remove it
Open
nicely.
surgery.
Yes. So we'd remove the uterus and the cervix. If it is later, now it has advanced, then we can't operate because we will not be able to remove it. Then we'd have to do radiotherapy and chemotherapy, but mainly radiotherapy.
Okay.
So that's for cervical cancer. Each cancer has its treatment. For example, for ovarian cancer, usually the treatment is surgery, so we operate first, and then chemotherapy. That one we rarely give radiotherapy.
Okay.
Yeah. Then there are also those cases which are too advanced. It has spread to the lungs, it has spread to the bones, it's spread everywhere. So we don't want to be too aggressive on the treatment. So we may give some chemotherapy, or we might do what is called palliative therapy, just to make the person comfortable, because we know we cannot cure them. The disease has gone beyond what we can be able to cure, so we would just try and make them comfortable for the last days in their life.
Okay. Actually, that was a question that I was going to ask you later, but if I can take a concern here from one of our viewers, Anasema Bilal here says that my wife just recently was diagnosed with the early stages of cervical cancer, but I'm just asking, can we still have a baby?
It depends how early.
Okay.
Because it depends on the stage. So there are some stage 1 patients where we may just remove the cervix and they can still get a baby. But most of them are not. We would not advise on because we would remove the uterus or would give radiotherapy. Once we give radiotherapy, the ovaries they will not work anymore, so we can't get pregnant. So there are even cases where if a lady is pregnant and she has cervical cancer, we would rather remove the uterus with the baby inside, because
the baby will not survive.
Yeah. So it is that dangerous, because cancer is not something that we like to give too much time.
Yeah.
Because you take time and it spreads and then you lose the battle.
Okay. On that response, Bilal here asks again, then how about, is there a chance in which we can have a baby even if it is to have a surrogate, or save my wife's eggs somewhere and have a baby if she may not be able to conceive?
Very good question. And actually those things are now available in Kenya, where if a lady for one reason or another has to lose the uterus, like for cervical cancer, then her eggs can be harvested. And then those eggs are stored somewhere. Then later on, they can use the husband's sperm, get a baby with the wife's egg, and then put that embryo or the baby into somebody else, the surrogate. Now the surrogate will carry the baby, and then when she delivers, she has to hand over to the mother. Of course, this has to be a very legal thing that is signed, because the lady who is carrying the baby what if she refuses to give the baby? Okay, so all these things have to be signed, usually through a judge or a magistrate. The law, I think, is being developed in Kenya so that we don't get issues of people fighting over a baby. Because who will be the real mother? Is it the one who carried the baby? Or is it the lady who gave the eggs?
Yes, we'll come back to that on the next question, because there's actually a question. There's usually a debate on surrogacy, especially in Islam as a religion. But let us take a short break. Mtazamaji, kumbuka unaweza kuendelea kutuma maswali yako kwenye social media platforms zetu, na wale ambao wameendelea kutuma maswali pale kwenye Facebook yangu, endelea kutuma maswali pale kwenye Facebook yangu @Mariam Kasim, nami nitaweza kuaddress maswali yako pamoja na daktari. Iwapo ungependa kupiga simu hapa studioni, basi uko free, unaweza kupiga simu. Tunachukua mapumziko mafupi, tutakaporejea tutaendelea na discussion yetu on cancer. Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
Horizon TV, the beacon for the nation.
Healthy Thursday is not just about diseases. It's about food, lifestyle, milestones in the medical practitioner's field, especially in our Muslim Ummah, and more so, your health. Discover breakthroughs and milestones in the medical field. Learn how to manage diseases.
That was not painful.
Join the discussion. Make better decisions on your meal plans. Improve your lifestyle.
All the doctors who are there were tired of working in maternity and taking care of women. And they say, you are the new kid on the block. We are leaving this department to you.
Healthy Thursday is about you, about your family, your lifestyle. So keep it locked Horizon TV on Healthy Thursday with me, Mariam Mwacharo.
Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show. Na mtazamaji, natabasamu hapa kwa sababu tulikuwa tunacheka kuhusiana na mambo ya umri na lile swala la daktari kusema kwamba menopause can actually hit you at 35. My producer is still laughing on the other side, but I don't know why. I will ask him. However, you have joined me on the second segment of the Sabah Show, watching Healthy Thursday, and we are talking about cancer. Now, I have with me Dr. Edward Sang, who is a gynecologic oncologist. Please do send in your questions on our social media platforms on Facebook, Instagram, and Twitter at Horizontv Kenya, or chat with me directly on my Facebook at Mariam Kasim, and we'll be able to respond to your questions. Or you can give us a call on studio or send us a text message, and we'll be able to respond to your question. Daktari, before we go on, I see Bilal here is a bit worried and he's still asking questions. Anasema kwamba, what is the relationship between the cervix and the uterus? If it is the uterus can be removed, how does it then affect if the cervix can be removed rather, how does it affect the uterus in development of the baby and cancer?
Yeah, the cervix is the mouth of the uterus, or the lower part. Usually when we are treating the cervical cancer, we are treating like the whole uterus.
Okay.
There are certain situations where, for a lady who is young, doesn't have and still wants children, we can remove just the cervix and leave the rest of the uterus.
And
But
she can be able to get children.
Yes, but that is only in very early stages of cervical cancer. Only we call it stage 1A and 1B1. Those are the ones which qualify. And for the time I've been working, we rarely get the cancers at that stage.
Okay.
We usually get them at 1B2 and even stage 2. So we would have to get a stage of that cancer and then make a decision. Because we don't want to risk his wife's life by being too, by trying to avoid the surgery or the treatment.
Okay.
Yeah.
And just before we took a break, we were talking about having a surrogate to actually have a baby for a lady who might, have cervical cancer. Now, there is a debate. Some scholars, especially in Islam, some scholars are not in support of surrogacy and some scholars are. But there is a very huge debate and it is still something that is liquidy, it's still in the fluid. So for some couples who do not have an option of having a surrogate, what is the option to having a baby?
Because once the uterus is out and it's what carries the baby, then we are really out of choices. So it's either surrogate or adoption. Because she can't carry once the uterus is out, she can't carry her own baby.
Okay, so what about the IVF that you were talking about?
Also, IVF would for a lady to undergo IVF, her uterus has to be okay.
Okay.
So the uterus has to be there. So if her uterus is not there, then she can't undergo IVF.
So it's either adoption
or the surrogate.
Okay, or the surrogate. Okay, Bilal, we are sorry because you've sent me some very sad messages on my inbox on Facebook, but those are the responses that we have had from the good doctor. You can take a look at IVF if depending on the stage that your wife is at with the cancer, and we can see what options you have, or adoption if maybe surgery has already been done. I'm taking a look at a comment here from Louis. He says, good to have you back. Your scope of questions and in-depth knowledge of the topic at hand, mashallah. Mashallah alaik. Very proud of you. Thank you very much, Louis Kelby. Thank you. And continue watching Horizon TV. Daktari, if I can come to you now and we continue our discussion. Okay, we have a question from one of our viewers. He says, I got pancreatic cancer na nateseka sana. However, what are the signs that I possibly can advise some of my family members to look out to if they might have any type of cancer whatsoever? And also, I am not, okay, he is not very able to take care of himself because of finances. What advice could the good daktari give me? So question number one, telltale signs, pancreatic cancer or any other type of cancer to his family members. He also asks, what advice could you give him since he cannot afford the total treatment? And he's also typing, okay. And he sent, okay.
Yeah.
Okay, yes. Let's start with the first question.
Oh, yes. So any person who has had any cancer, there's a small chance of family members being prone to either that cancer or different types of cancer. So, for example, if a lady has breast cancer, then her daughters are at very high risk of breast cancer or ovarian cancer or thyroid cancer or cancer of the colon or the stomach. So those relatives have to be watched very closely. Sometimes we do what is called a pedigree, meaning we can draw your family tree.
Okay.
From your grandparents, your uncles, aunties, brothers, sisters, and then we try and map out which people have had cancer. And you might find in some families, a grandfather had, the uncle had another cancer, the cousin has another cancer, things like that. So we try and assess and see if there's risk for the individual being at high risk of cancer. So there's what is called screening for different types of cancer. For example, breast. A lady who has family history of breast cancer should do ultrasounds and mammograms of the breast early. If somebody has had if there's colon cancer in the family, then somebody should undergo colonoscopy and then endoscopy to check the stomach.
Okay.
Pap smear, of course, is routine, a lady past 21 should have a pap smear every 3 years. And then if there's pancreatic cancer, then maybe every few years it's good to have a look at the pancreas, either by MRI or ultrasound or CT scan. Unfortunately, some cancers are very hard to screen for. So we are at, so there are only a number of cancers that we screen for. For example, cervix, colon, stomach. Others, unfortunately, you can't do much, like maybe the brain, brain tumors, blood cancers. Sometimes are a little hard to tell in advance. We only find out when you already have it.
Okay. Okay, so the next question he had is if it can be passed on to a family member, which I think you've already answered. But let's take a look at diet, okay? Is the diet for a cancer patient different? And if so, how?
Not really. There's also the question about whether diet can contribute to a cancer. Generally, the way diet contributes is obesity.
Okay.
When somebody is too obese, then that has been shown to have a high risk of cancer.
Okay.
So each cancer again has risk factors. So for example, smoking and lung cancer, the human papillomavirus and cervical cancer, then breast cancer, family history, having no children. In other words, ladies who breastfeed more and have more children have less risk of breast cancer.
Really?
Yeah. So breastfeeding reduces the risk of breast cancer.
But at the same time, there's like family planning and...
yes, of course. But now you have to look at both sides because they've looked at women with breast cancer and they've realized those who have more kids and breastfeed more are likely to have breast cancer less.
Okay.
The same with ovarian cancer. Ovarian cancer is more in women who've never had children.
Okay.
Those with more children rarely get ovarian cancer.
Hey.
Yeah.
So that gives the importance, you know, in the Quran. In the Quran, we're actually told, you know, breastfeeding period is 2 years. The Quran gives it's a way of life. It gives specifics for everything. So the period for breastfeeding is 2 years, and you know, you space your children 2 years. So actually, the more children you breastfeed, the less chances of breast cancer, and the more children you have, the less chances of ovarian cancer.
Yeah.
So kwenu kina dada wenzangu ambao tayari wameshaelekea katika ile safari ya ndoa, tayari wako kwenye ndoa, basi ujue kwamba the more you breastfeed, the less chances of breast cancer and the more children you have. However, you need to be able to provide for these children, and Allahu Razak, but you know, you also need to do something about that. But the more children you have, the less chances of ovarian cancer. So we've talked about that. Most of the time, Daktari, when someone is actually diagnosed with cancer, they actually take that as a death sentence. What are the chances of survival in different types of cancer, especially the common ones that you know you've mentioned that affect our people here in Kenya?
Well, it generally depends on the type. Some are very aggressive.
Okay.
And others are not aggressive. They are very mild or benign, meaning they grow slowly, they don't spread. So those ones might be easier to deal with. Some, even when you find it early, that type of tumor is so aggressive that even if you treat, they tend to come back very quickly. So those are some of the determinants. So that's why we try and find them early, because the earlier you get the cancer, the easier the treatment. Rather than somebody who the growth is already all over the body, then treatment becomes much harder. The response is harder. Even the person's ability to cope with the treatment, because some of the dawas are extremely strong on the body, the chemotherapy. So if somebody comes in when they are weak, they are anemic, they are not eating, they are vomiting, they have diarrhea, then already this is somebody who may not be able to tolerate all the medications.
So it's not really a death sentence?
No, it's not. We also have to counsel the patient and the family. Some are aggressive, and at times again we have to be open with patient.
Yeah.
We don't want to promise them that we are going to cure you from the cancer when we know that they probably are not going to last another 1 year. We have that problem as clinicians, because sometimes the relatives also don't want you to tell the relative, the patient. So they might tell you, we know she has cancer, but please don't tell her, because she's going to get depressed or things like that. So just tell her it's a growth and things like that. So it becomes very hard on us.
Yeah. And I'll come back to you on that same issue about the role of the family or the support system, because if we talk about the role of the family, you know, sometimes even the family does not support you. And I'm very grateful, actually, when I was doing this research, I was doing with a very important young lady, and she really helped me phrase some of these questions. Naima Abdul Karim, thank you so much. But let's take a short break. When we come back, we'll delve more into cancer and get to learn more. Remember, mtazamaji, you can give us a call on studio on the numbers on your screen, or send us a text message, or you can even text us on the social media platforms on Facebook, Instagram and Twitter at Horizontv Kenya, or you can chat with me directly on my Facebook at Mariam Kasim. See you in a short while. Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakuita wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
Horizon TV, the beacon for the nation.
Healthy Thursday is not just about diseases. It's about food, lifestyle, milestones in the medical practitioner's field, especially in our Muslim Ummah, and more so, your health. Discover breakthroughs and milestones in the medical field. Learn how to manage diseases.
There was no painful.
Join the discussion. Make better decisions on your meal plans. Improve your lifestyle.
All the doctors who are there were tired of working in maternity and taking care of women. And they say, you are the new kid on the block. We are leaving this department to you.
Healthy Thursday is about you, about your family, your lifestyle. So keep it locked Horizon TV on Healthy Thursday with me, Mariam Mwacharo.
On the next episode,
dawa ikiwa kuna watu wanasimama wakaifanya ikafanyika kiasi vile inavyotakikana, wasiosimama hawana wajibu. Lakini kawaida vile vile si rahisi mtu kutokuwa na jukumu la dawa hata kwa njia ndogo. Kwa mfano dawa ya watu wengine pengine taka wanavyuoni au kiasi kadhaa, na si lazima wanavyuoni, kwa sababu balighu anni walau aya, itekeleze kutoka kwangu hata aya moja. Almuhimu lile analolisema uwe walijua wewe kidini iko vipi. Waamrisha watu bilbirri, kufanya mambo mema, na nyinyi mjisahau nafsi zenu, lakini haimaanishi ufai kufanya, na ukifanya utapata taabu yake. Lakini ni bora uwe wewe waamrisha na wayafanya, na ukataza na wewe mwenyewe umejiziwia.
Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakuita wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show. Na Shukran sana mtazamaji kwa kuweza kuungana nasi. Tuko katika kitengo cha mwisho cha The Sabah Show Healthy Thursday, nami Mariam Mwacharo. Tunaangazia swala zima la ugonjwa wa saratani. Mtazamaji, wapo na maswali yako ungependa kuuliza, basi bila shaka uliza katika nambari zilizoko kwenye screen yako. Unaweza kutumia arafa ama utupigie simu kupitia nambari iliyoko kwenye screen yako. Chat with me directly on my Facebook at Mariam Kasim, or you can also get us on our social media platforms on Facebook, Instagram and Twitter at Horizontv Kenya. And I do want to send special thanks to Naim Abdul Karim for helping me through this research. Let me come to a question that I was just talking to you about. Before we took a break, we talked about the role of the family. You told us that as clinicians, you have a problem. You know, wazazi wakija hospitali, mtoto wao pengine amepatikana na saratani, they tell you, don't tell her it's a growth because she'll be depressed and everything. What is the role the family or any support system rather should play you know, during the time that the cancer patient is actually seeking treatment and recuperating if possible?
I think, yeah, the family plays a very big role because they're the ones who will support the patient, take her to the hospital, give the treatment at home, look out for any serious complications, counsel, support, even prepare for those who we know they're going to die. Then they have to be prepared, and they are the ones who sort of sort things out, like those who need to give away property and things like that. The family are supposed to be there to help. And then also sometimes these patients are not able to do the activities of daily living. They can't cook, they can't clean themselves, they can't make their bed. So they're basically almost handicapped, and they need people around them to support them. We've had patients left in hospitals because at times it also takes a toll on the family. So sometimes they just leave them in the hospital and never come back.
Abandon them?
Yeah. So we do get those, and it must be very tough on the patients.
I do have a comment here from a lady. She does not want me to mention her, but she says, I have leukemia, and yes, I have experienced some of my family members abandoning me and getting tired of me, and I have only looked to friends, but sometimes it is also very difficult. As a patient, what should I look at? How should I take care of myself better when I face such situations with my family abandoning me? I know that they love me, but sometimes things can be very difficult.
Yeah, it's a tough one. It's a tough one. I think friends and family have to try to be patient, to be kind, and to be there, because I think being abandoned is probably the most difficult part of the cancer. You might manage the pain, manage the vomiting and things like that, but the presence of family members, I think, is extremely important.
Okay, Daktari, if I may come to you again, you know, most of the cancer patients are very prone to opportunistic infections, and because this is because I think the immune system is compromised and it's, you know, weak. What should a patient do to prevent getting opportunistic infections as a cancer patient?
Yeah, before treatment, we always check like the white cell count, the white blood cells, to make sure they're okay. If they're low, at times there are medications to try and boost the white cells, or we delay treatment.
Okay.
For example, if it's chemotherapy, if the cells are too low, we delay treatment, because if they go too low again, then you can even get a cold, and it gets too, it's too dangerous. In certain, for those who have certain types of leukemias or tumors of the cancers of the cells, white cells, then and they're going for bone marrow transplant. Sometimes they have to be in a room on their own for a while, so that no infection comes in. So everything has to be sterilized. They have to be alone, because usually they are given treatment to clear all the white cells, so there are no white cells in the body. Then they now get a transfusion. So at that time, somebody is very prone to getting very serious infections. So the environment has to be controlled.
And for cancer patients who have actually gotten, opportunistic infections, what should they do so that these infections do not recur?
Well, usually cancer treatment is usually what we call multidisciplinary, meaning we are many doctors taking care of the patient. So we have physicians who are good with treating these infections. For example, if it is certain types of TB or pneumonias or skin infections or intestinal infections, they're able to treat it with good medication so that we clear it quickly, and then again make sure the person is in good health, maybe transfuse them, give them medication to boost their white cells, use antibiotics so that we prevent any of these infections.
Okay, there is a question. There's one of our viewers who's actually, she wants to say, Mariam, kindly tell everybody that cancer is not a death sentence. I've had my child who's had cancer since she was 6 years old, and right now she is 15. We are still going on strong. Yes, there are difficult times, but all they need is lots of hugs, kisses, and encouragement as well as support. So remind people that cancer is not a death sentence. Thank you very much, Juwairia, for that question, for that actual comment rather. Thank you. Cancer is not a death sentence, as Juwairia says. Anasema kwamba she's had a child who's had cancer since 6 years old, and now she's 15 and they're heading on strong. She says, yes, things can get thick and difficult, but all in all, they need lots of hugs, kisses, and encouragement and support. Okay, thank you very much, Juwairia. Daktari, coming back to you, when it comes to, cancers, some of the cancers, according to research, have been found to be cured by Ayurveda or homeopathic, treatment. As a medical professional, what is your take on homeopathic treatment and Ayurveda?
Well, I'm very skeptical myself because for medicine, we have to see what causes, like for example, cervical cancer. We see what causes it. We see the stages, and we see the different types of treatment which are researched and tried and retested. So unfortunately, I'm not able to really comment on the alternative medicine.
Yeah.
There are also herbs and things like that.
Yeah.
We've also had patients who've been mismanaged by herbalists who say, oh, I'll give you this dough for 3 months and the cancer will be gone.
Yeah.
So we've had people coming with cancers which maybe if they had been treated earlier with medical treatment, then they would be better off. Then now we've wasted time with the herbs which have not worked. So now the cancer has grown to a level where treatment now becomes a little more difficult.
Okay, so actually that was actually one of the concerns of, some of my friends that I spoke with when we were doing the research. Daktari anasema kwamba because they have not been clinically tested, so do not rely on them. And just to make it clear, Ayurveda treatment is a traditional Hindu system of medicine which usually uses the balance in bodily systems and uses diet, herbal treatment, and yogic breathing to give cure to different kinds of diseases in the body. Many people usually have this kind of belief that whatever disease you have, then the body can cure itself. And this comes from the belief from the scientific, discovery that the body always fights. Your body always fights, no matter what you have. When you have a cold, that's why, because sometimes ukiwa na ugonjwa fulani, you're just told to rest and take a lot of fluids and, improve your diet because your body is always fighting. So Ayurveda usually uses the body systems because the body is always fighting to cure. And then homeopathy uses traditional systems. Say for example, say for example, when I was doing research homeopathic treatment, say when you get a cold, they use onions, to treat flu because onions give you a cold. But maybe Daktari, because you're the professional, maybe you can give us more light into that if you may know a thing or two about homeopathic treatment.
Even that is sort of outside my field, and so unfortunately I'm not able to comment so much. But of course, if something has undergone research, has been tested many times, and the outcomes are good and reproducible, then it's probably something that is worth trying.
Okay, so with medication, definitely there's usually side effects. Yeah, even when you have a headache, when you get painkillers, they tell you a side effect could be this. When you have a cold, when you take antibiotics, you're told that a side effect could be this. What sort of side effects are we looking at once we begin treatment for cancer?
Oh, there are so many, because they can have complications of the operation itself. There's complications of radiotherapy and complications of chemotherapy.
Can you mention some of them?
For example, chemotherapy, you can get an allergic reaction. Vomiting is so common. Diarrhea is so common. The white cells going down is so common. Getting anemia is very common. So in fact, we have what is called pre-medication, meaning before we give the chemotherapy, we give the patient some medicines to prevent those side effects. For example, we'll give you medicine to prevent vomiting. We'll give you medicine to prevent allergic reaction. We'll give you fluids so that again they don't affect the kidney, because again some can really affect the kidney.
Yeah.
And then we do tests all the time. We check your kidneys, we check your liver, we check your blood counts to make sure that the chemotherapy is not affecting you too much. And if it is, we may have to give time. Radiotherapy, for example, in a young lady, it's going to damage the ovaries.
Oh yeah?
So if a lady is done radiotherapy around the uterus where the ovaries are, then the ovaries are damaged for
That's
good.
only around the uterus, or radiotherapy anywhere on your...
Mainly around the uterus, because if it's directly on the ovaries, then it will damage the ovaries.
Okay.
So children, there'll be no hope for getting children. It also affects the intestines and the bladder. So some patients will get blood when they pass urine, or blood when they pass stool.
So they should not be alarmed, or should they be alarmed?
No, they still need to report it, because there are some medications we can use to help with that. And some of the treatment also causes more cancers. Some chemotherapy can give you another cancer.
Wow. What?
And radiotherapy can also cause another cancer. So those are again some of the side effects. Yeah.
Okay, some of the side effects of some of the treatment of cancer there we get to learn. Daktari, very quickly, maybe when we finalize on this rather topic today, what are some of the misconceptions surrounding cancer as a disease and as a topic in general?
Well, what I find sometimes is some people say, don't test me because I don't want to know, because if I know, I would rather not know. But if I know now, I'll be so stressed. So they feel, don't test me, just leave me. If it's there, it's there. But you see, we now lose the opportunity to get the cancer early and treat it early. Maybe it's not even there. In fact, most of the time, it's not there. We do thousands of pap smears, and we don't get anything. It's actually, in fact, those who get cervical cancer are most of the time those who've never done a pap smear.
Okay.
Most of it, and they've never heard of it. So we still need education. So programs like this are very important, because you might find somebody who's watching and has never heard of a pap smear. Then they might now come to the hospital and say, I heard about pap smear. Can I do one? I've heard of mammogram, and I'm thinking I should do one. Things like that. So education is important, especially in our third world countries. NHIF has played a big role, because now it's actually paying for a lot of treatment for chemotherapy, radiotherapy. So that is a big advantage, because as somebody mentioned, it's very expensive. And at times you can't pay for it on your own.
Definitely. Thank you very much, Daktari. We definitely haven't exhausted everything. There's so much more to delve into, and there are a couple of questions that I couldn't take on air. Muse, you sent a question. I could not read it, but I will give it to the Daktari as you have requested. And then someone else there, okay, yes, I'll give you, some people are asking for the contact here. Daktari will definitely be able to get back to you with those ones. So kwa wale ambao maybe I have not mentioned you and you're wondering, I have gotten your comments and I will get back to you on them. The questions will be given to the good doctor, and the contacts also will be shared. Thank you very much for joining me on today's episode, talking about, generally about cancer. On the weeks to come, inshallah, we shall progressively look at cancer in depth, breast cancer, cervical cancer, and some of the most common cancers that are actually affecting, people here in Kenya, according to the statistics. And as well, if it's possible, we can take a look at cancers that are affecting children. And endeleeni kutuma comments zenu on our social media platforms on Facebook, Instagram and Twitter at Horizontv Kenya, or you can send us your questions on our lines on the screen and we'll be getting back to you. For now, we are taking a final break and saying goodbye. But before that, let me read the last comment from Mr. Luai Lui here. He says, in medically advanced countries like India, homeopathic treatment is not only taken up in the traditional sense, modern equipped institutions are in place for homeopathic treatment. Thank you very much, Luai Lui, there for your comment. We'll be taking a deeper look into that, and if possible, we can actually, get a contact from there and also delve into the same. Thank you very much for joining me, mtazamaji. Do not stop sending your comments and your questions, and as well, there's a suggestion here to discuss on a type of cancer. Also, your suggestions, will be taking them into account. Daktari, thank you very much for coming. Definitely, we could possibly invite you again next week as we continue on this topic. Remember, mtazamaji, as the doctor said, knowledge is power, and you remember in the Quran we are always reminded of this. The first ever verse that came to us and to the Prophet ﷺ is Iqra bismi rabbika alladhi khalaq. So let's be in search of knowledge always. From me to you is thank you and ma'asalama. Till next week, I'd like to say a special thank you to Naim Abdul Karim for helping me in my research, Muhammad Shakombo, my producer, akisaidiwa na Abdul Ghafur Anasi hapo awali, Saida Abud, Mohammed Otweo, and our technical directors from our sound people. We had there Nasir, and we have Hashim and Binyamin. Thank you very much. Sadika Bitam, sija kuacha nyuma. Shukran kwa kuweza kufanikisha show yetu ya leo. From me, ma'asalam. Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
Horizon TV, the beacon for the nation.
Papa.